This video, I'm gonna go over the disease sheet. I made my own variation of it, of anemia. Okay, so usually we focus more on three types of anemia: iron deficiency anemia, folic acid deficiency, and also B12 deficiency anemia. And I'm going to kind of go over the signs and symptoms, pathology, and give you some little tips and tricks to remember. Okay, so the signs and symptoms of iron deficiency anemia. Now, all the anemias have common signs and symptoms, okay? So you're not going to have to memorize a whole bunch of stuff. I'm just going to give you some tips. So you can remember the mnemonic low iron. So L stands for lethargic. So if you have low iron helps transport hemoglobin on the red blood cell, which is why you get the symptoms, because you have low hemoglobin, which causes low oxygenation in your bloodstream. So you're going to be very lethargic and tired if you have anemia. Overexerted easily. So that means people with anemia get shortness of breath or dyspnea on exertion. Like if they walk up a flight of stairs, they might be like really short of breath. They can get dizzy, so you have to, watch out for fall precautions and tell them to rise slowly. They may have weird food cravings. Seriously, they may want to eat clay or dirt, which is called pica or pica. And some people with anemia start chewing ice. So that may be a sign to you if you see people at the hospital chewing ice. White face means they get very pale. And remember, for dark skinned people, we check for pallor in their mucous membranes and their nail beds. And then they'll have an increased heart rate. Tachycardia is an indication that your body needs more oxygen. Okay, people with anemia could have inflammation of the tongue. And this is more common in B12 anemia because they get that smooth, beefy, red looking tongue. People with anemia could be irritable because if your body is not getting what it needs and you're tired and dizzy, you're going to be irritable. Reduced hemoglobin level, that's one of the signs of it. Observe red blood cells. So in iron deficiency anemia, the red blood cells are going to be microcytic, meaning small, and hypochromic, meaning pale. So they're pale and small. And then in vitamin B12 deficiency, the red blood cells are big. So you don't really need to know that. There's going to be some nail changes in people with iron deficiency anemia. They get what's called spoon nails. And Google that so you can see what that looks like. And neuro changes are more common in vitamin B deficiency anemia, but they can happen also in anemia. So with vitamin 12, B12 deficiency anemia, the other name for that is pernicious anemia. And the word pernicious means deadly. And this disease was deadly until 1926 when some physicians figured out that if you eat raw liver, so organ meats, that it cures this B12 deficiency anemia. It's an autoimmune condition that happens to people over 60. Okay, so they kind of figured out it's nutritional and that you can treat it with B12 injections. So people with vitamin B12 deficiency are going to have paresthesias, which means they have like numbness and tingling in their hands and their feet. They could lose their balance, so they could be at risk for falls. And how I remember that they have paresthesias is that P stands for paresthesias and pernicious, okay? The pathology, anemia can happen for a lot of different reasons. For example, blood loss during surgery, trauma, GI bleeding, which you'll learn about in med-surg too. There could be an inadequate production of red blood cells that's causing anemia. It could be hemolytic due to destruction. I'm just going to give you an example. You don't have to write it down or anything, but people with renal failure have really high BUNs, and it causes the red blood cells to lyse. So the red blood cells lyse. Runners, because if they're running high volumes, meaning they're running a lot of miles, their foot is hitting their pavement, and that is causing the red blood cells to lyse. So runners can get anemia for that reason. And lack of nutritional components, like you're not eating enough iron or folate or vitamin B12. The types of anemia, you can remember the mnemonic always introduce special patients. Stands for A stands for aplastic anemia, that's a type of anemia. I stands for iron deficiency. S stands for sickle cell. Now you're going to learn that about sickle cell anemia in pediatrics, okay? And pernicious, which is the B12 anemia. I didn't mention that folic acid anemia is not mentioned on this mnemonic, but that's another type of anemia that we worry about in pregnant women because it can lead to neural tube defects if a pregnant female does not have enough folic acid in their diet. For health promotion and disease prevention, eat iron-rich foods and eat foods high in folate. So foods that are high in iron, you can remember eat lots of iron, so egg yolks, apricots, tofus, legumes, which are beans, and leafy green vegetables. So like spinach, Swiss chard, kale, those kind of vegetables are very good. Oysters, tuna, sardines. So you're seeing a theme here. A lot of food from the sea is high in iron. Seeds, potatoes, fish, iron fortified cereal and breads, raisins, red meat, poultry, and nuts. Okay, so those are foods that are high in iron. And the foods high in folic acid, leafy green vegetables are good to eat as well. The risk factors, I talked about major surgery, trauma, GI bleeding, heavy periods. Females who have heavy menstrual periods could be at risk for anemia. People that are going through growth spurts, like pregnant women, adolescents, they are also at risk for anemia. Certain types of infection can get anemia, like they can get aplastic anemia. Older adults. Now, older adults could be more prone to pernicious anemia because as you age, your stomach lining produces less intrinsic factor. Intrinsic factor is secreted from your stomach. It binds with B12 in the stomach and it's carried away to the intestines to be absorbed. So if you don't have intrinsic factor, which could be due to an autoimmune disease, it could be due to getting older, it could be due to gastric bypass. Okay, so those people with no intrinsic factor need B12 injections monthly. Okay, because they can't take it orally because they need the intrinsic factor to absorb it. Okay, chemotherapy, which we're talking about for this exam. So when people go through chemotherapy, in about 9 to 14 days, they could have bone marrow suppression. So that means they're not going to have red blood cells, thrombocytes, which I'm going to talk about in a different video, and white blood cells, which is called neutropenia, okay? But anemia is a reduction of the red blood cells. Radiation can also cause a reduction in red blood cells. So the complications of having anemia, anytime you're deprived of oxygen and your heart is beating hard and fast, right? Because the heart is trying to compensate and get oxygenated blood into your system, so it's going to pump harder. Well, the heart is a muscle, and like all muscles, as you age, they are going to get weaker. Okay, so they could get heart failure. And we're going to talk about heart failure later in the semester. And then blood transfusion reactions could be like a complication for people that are treated with blood transfusions for their anemia. Okay, to diagnose, the clients undergo lab tests. So the CBC, which stands for complete blood count, will show a low hemoglobin and low hematocrit. So the hematocrit is a percentage of the red blood cells in the system, okay? And you can figure it out by multiplying the hemoglobin by 3 to get the hematocrit. You don't have to write that down or anything. I'm just giving you some examples. Ferritin is a blood test, and it indicates what the total body iron storage is, and TIBC is increased in iron deficiency anemia, and they'll also have low blood iron. I wouldn't worry about that so much. That's just interesting. And you could bring this sheet to clinical in case you run into anybody that has anemia. The Schilling test is for vitamin B12 deficiencies. Now, the main thing that's really important for you to know, if you're going to draw the blood, the specimen labeling has to be done at the bedside. You have to check the patient's name. So you'll get like usually lab labels. So make sure the name matches your patient's name, the date of birth, the medical record number, and the room number. Date and time collection. Now, the room number isn't a National Patient Safety Goal identifier, okay? But the medical record number and the date of birth is. You're going to date and time the collection. Usually, wherever you work, they're going to want you put your initials, maybe your employee number, and because a common mistake is mislabeling, and you do not want to mislabel lab tests. Okay, and then the treatment for anemia. So if somebody is suffering from shortness of breath, you're going to do O2 sats, and that will determine if they need oxygen therapy. Energy conservation. So what I mean by that is people with anemia need to learn to balance periods of rest with periods of activity. They're going to get tired really easy, so they may need to nap throughout the day. You're going to need to teach them to rise slowly, especially if they become orthostatic or become like dizzy when they stand up. So they'll need fall precautions. Blood transfusions is a form of treatment. You're going to be learning about that this semester in IV therapy. In the medications, I'm going to let your pharmacology teacher, instructor teach you this when you get to it. Just a few things. If you have to give iron via parental administration, which means, usually an injection, it needs to be Z-tracked. So an IM injection needs to be Z-tracked. Epoetin alpha, this is mimics erythropoietin, which is secreted from the kidneys. You'll learn about that in A&P, which helps stimulate the production of red blood cells. The main thing you have to watch out for is headaches and hypertension on that medication. Oral iron, you may be giving this in clinical before you learn about it in your pharmacology class. So you have to protect the teeth, because if it's liquid iron, a liquid solution, it could stain the teeth. So you're going to make sure you use a straw and dilute it. Orange juice would be fabulous because vitamin C helps the body absorb iron. And if they can take it between meals, that's good, but sometimes it can irritate their stomachs. And reminds patients that their stools are going to turn black or a greenish black color. Vitamin B can be given to people who do not lack intrinsic factor, like vegetarians oftentimes don't eat, well, they obviously don't eat meats, but that's where that's a reason that they do get vitamin B12 deficiency. So if it's just because they are not eating foods that contain vitamin B12, they can take it orally. People have to take it parental if they have the autoimmune disease, where they don't have intrinsic factor, or if they had a gastric bypass and they can't make intrinsic factor, they'll have to get monthly shots of B12. All right, that's anemia in a nutshell.